Does isradipine interact with other medications? Isradipine is a calcium channel blocker that is primarily used to treat high blood pressure. However, it has also been studied for its potential neuroprotective effects in Parkinson's disease. Understanding how isradipine interacts with other medications is crucial, especially for those with Parkinson's disease who often take multiple drugs. There are over 470 known drug interactions with isradipine. These interactions can be classified as major, moderate, or minor, and they can affect both the effectiveness and safety of isradipine and the other medications involved. For example, when isradipine is combined with antihypertensive agents, it can be safely used with some medications like hydrochlorothiazide, a diuretic. This combination may enhance the blood pressure lowering effects without altering how the drugs work in the body. However, caution is needed when using isradipine with beta blockers, such as propranolol or carvedilol, as both can affect heart rate and blood pressure. There have been reports of severe low blood pressure when isradipine is used alongside fentanyl anesthesia and beta blockers. When it comes to anticoagulants like warfarin, studies have shown no significant interaction in terms of how the drugs work in the body. Still, monitoring is recommended to ensure safety. Similarly, there is no significant effect on digoxin clearance, but healthcare providers may still suggest monitoring its levels. Another common medication, cimetidine, which is available over the counter, can interact with isradipine and may affect how it is metabolized in the body. Isradipine can also influence the metabolism or excretion of several other drugs, including benzodiazepines and abacavir, potentially increasing their levels in the blood and the risk of side effects. Patients should also be aware of food and alcohol interactions. Grapefruit products should be avoided as they can interfere with how isradipine is metabolized. While there are a few known interactions with alcohol and food, discussing diet and alcohol use with a healthcare provider is essential. For those with Parkinson's disease, who often take multiple medications for symptom management, careful review and monitoring by healthcare professionals are vital to avoid adverse effects or reduced effectiveness of treatments. It is important to note that there is no evidence supporting the use of isradipine as a replacement for standard Parkinson's treatments. It is considered experimental for neuroprotection and should only be used under medical supervision. In summary, isradipine interacts with many medications, including antihypertensives, beta blockers, warfarin, digoxin, and cimetidine. These interactions can alter drug levels or effects, making careful monitoring and dose adjustments necessary. Always consult with healthcare providers before starting or combining isradipine with other medications to ensure safety and effectiveness.